obulamu buno bufaanana ng'eccupa eya gripu ku mulwadde etonnya ettondo limulimu bw'olaba erwawo kuba etonnya ttondo limulimu naye buli eritonnya teriddayo bw'ekyonebwamu ekyo tukigeraageranye ku bulamu buno tulabe nga n'owaakeesa olunaku lumulumu nga lukyanga zikuweddeko ennaku zo tukeesa lumulumu terudda omuwendo gw'ebiseera bwe gutyo ozannyira mu budde bw'ofunye kiba kitalo nnyo ekyo tukigeraageranye ku bulamu buno tulabe nga n'owaakeesa olunaku lumulumu nga lukyanga zikuweddeko ennaku zo tukeesa lumulumu terudda omuwendo gw'ebiseera bwe gutyo ozannyira mu budde bw'ofunye kiba kitalo nnyo obulamu buno buwenyuka ng'essasi olw'obutamanya ne tusooba ne tufa nga bingi tetubikoze kityo yagenda essira kumwa yafa apangisa iri ntinda abantu be yabaleka mu kazigo nga buli mwaka ajuliza buddako ekyo tukigeraageranye ku bulamu buno tulabe nga n'owaakeesa olunaku lumulumu nga lukyanga
Professor Sagani Musisi, I'm a psychiatrist. I used to work in Makerere University Medical School and Nakasai Hospital. I am now here at Entebbe Lakeside Hospital on Chitinda Road in Abaita Ababiri. And my job is to treat patients now and do some research still. I've been a psychiatrist for a long time and I've enjoyed the job and I enjoy talking about mental illness.
eya gripu ku mulwadde etonnya ettondo limulimu bw'olaba erwawo kuba etonnya ttondo limulimu naye buli eritonnya
According to the World Health Organization, health is defined as physical, mental, and social well-being, and not just the absence of disease or infirmity. Which means that to have total health, you must be mentally healthy. Now, mental health involves being able to enjoy life, to face daily challenges, to be able to relate to people meaningfully, and to realize your potential intellectually, professionally, and in society, and not just the absence of mental illness. Mental illness is that psychological, emotional, and behavioral state which allows you to enjoy life as described above. Causes to use simple terms, can be physical, social, or psychological. Some people also put on spiritual, but usually doctors include the spiritual into the social, cultural. One can have injury to the brain, and you can have a physical illness. The brain can be infected with bacteria, viruses, including COVID or HIV or other viruses, even flu. It can also be affected by things like cancer, by strokes. All of those things can cause mental disturbances. But it can also be affected by psychological stresses, which make you worry, not being able to sleep, not being able to eat. All of these things can cause stresses. Also, social problems like extreme poverty can cause stresses. Basically, what it does is that it changes the chemical balance within the brain so as to cause mental illness. So mental illness can be acquired, sometimes it can also be familial. And as long as one has a brain being part of the body, you can have mental illness, even before you are born. And certainly a baby is born with a brain, and we stay with our brains until old age. So any time, one can have a mental affliction. So there are many causes, there's not just one single cause. Maybe I should say what it is not caused by. It's not witchcraft. It's not demons. It's not maginis. It's not curses. Mental illness is an affliction to the brain and the way it works, such that it causes symptoms. The brain has many functions. It is the master organ of the body. And it works every day. And it is the most protected part of the body. It's the skull. Bone protects it. Some other parts of the body are exposed to easy injury.
Akuuma nnyo budde naye waneewaffe n'ebitatugasa tugenda tulabe. Okukeerewa tukimanyi tukikola era twenyumiriza. So nno we tutamanya biseera byegulumye. We tutamanya biseera